Escherichia coli is a gram-negative bacterium commonly found in the intestine of humans and other animals, some strains of which can cause severe food poisoning. E. coli can cause diseases by invading tissues, by producing various toxins, by adhering to tissue, and by forming aggregation or clumps of bacteria. Urinary tract infections typically occur when the bacteria enter the urinary tract through the urethra and begin to multiply in the bladder. The most common urinary tract infections occur mainly in women and affect the bladder and urethra. Cystitis. This type of urinary tract infection is usually caused by the E. coli. However, sometimes other bacteria are responsible. Sexual intercourse may lead to cystitis, but you don't have to be sexually active to develop it. All women are at risk of cystitis because of their anatomy.
Escherichia coli reproduce by cellular division by using asexual reproduction. Because there is no transfer of genetic material, bacterium make an exact copy of itself. The individual bacterium begins this process by elongation of the cell, followed by almost exact replication of the genome. So there are two identical copies. A septum is formed and the cell equally divides the cellular components, and one copy of the parental genome gets placed in each side of the cell, leaving two copies of the original bacterium called daughter cells.
General signs and symptoms for urinary tract infection are cloudy, dark, bloody, or strange smelling urine. In women, it causes pelvic pain, and in men, it causes rectal pain. Signs and symptoms according to the place of infection. Part of urinary tract affected can be the kidney, bladder, and urethra. Symptoms of urinary tract infection in kidneys like shaking and chills, nausea and vomiting, and high fever. Signs and symptoms in the bladder can be pelvic pressure, blood in urine. Signs and symptoms in urethra are burning with urination discharge. Lab tests for Escherichia coli. Escherichia coli can be tested by using gram stain, which give a negative result. Escherichia coli found under the microscope a motile rod shape. Doing the catalase test, Escherichia coli give positive result and negative with oxidase and urease tests.
Treatment. Antibiotics usually are the first-line treatment for urinary tract infections. Which drugs are prescribed and for how long depend on your health condition and the type of bacteria found in your urine. Drugs commonly recommended for simple UTIs include trimethoprim, sulfamethoxazole, fosfomycin, nitrofurantoin, ciprofloxacin, levofloxacin. UTI can be caused by other microorganisms than Escherichia coli, like Klebsiella, Enterococci, Staphylococcus saprophyticus. Risk factors. Men and women are more likely to get a UTI if they have kidney stones, a spinal cord injury, or other nerve damage that prevents them from completely emptying their bladder, thereby allowing bacteria to multiply. A urinary catheter, tube used to drain the bladder, sexual intercourse, immune suppression, pregnancy, diabetes, low levels of estrogen, and the well water or open water lakes, rivers frequented by animals.
Prevention tips to avoid getting an infection. Bathroom behavior, periodically emptying the bladder, a diet increasing water intake, hygiene, proper hygiene in caring for the urethral area, vaginal estrogen that helps in repopulating the normal vaginal lactobacilli to keep bacteria from the rectum from multiplying and causing bladder infections.
In summary, E. coli are a bacterium that live in our intestine that cause infection when our immune system are compromised. While it can happen in males, it's more common in female due to their anatomy, which helps the bacterium into moving easily, further assessing its ease of causing an infection. You can spot the place of infection by observing the signs and symptoms of the patient. And usually, these type of infections are treated via antibiotics as mentioned above.